When Molly Lucasen, now the manager of the Cognitive Behavioral Therapy program at the Visiting Nurses Association, was a young social worker visiting nursing homes, she had an epiphany. It was during her visit with a bipolar woman in her late 70s with no family that she realized there is a serious lack of resources for mental health for older adults. Lucasen and the other social workers would take turns staying with the woman all night when she was depressed and would sometimes bring her food from home.
And I'll never forget, probably 2 months before she passed, she came into my office. I was a social worker there, and she came into my office and she said, "I know what you all have done for me. I realize that you are my family, and I realize what you've done. I know that you were there at 1 o'clock in the morning holding my hand, or I know that I chased you around, you know, when I was high," as she would say it. And you all had such good patience, a lot of patience with me. And that story just stuck with me as a young social worker. And I said, you know, we really need to do more.
While older adults and their families are vigilant about physical pains and problems, sometimes it takes a while for families to realize that mom or dad is struggling with a mental issue.
I had a client one time that I was working with who had a very structured routine throughout his life. He would, you know, get up, get dressed, walk out the door, take a left down to Dunkin' Donuts. And the staff knew him. His gym, blueberry muffin, coffee, and he did that for years after retirement. And his family thought, okay, he's okay. And his daughter was visiting from out of state, watched her dad get up, get dressed, go to the door, and really struggle with, which way do I go?
Families or other caregivers of older adults reach out to Lucasen's group. Then, one of the 5 behavioral health clinicians whom Lucasen supervises goes to the older adults' homes and meets with them over 8 weeks to discuss their mental issues. Opening up and asking for help isn't always easy for older adults.
There's a stigma attached. So patients struggle to say, yes, I have anxiety, yes, I have depression, and I would like some help. I have one patient in particular, we'll call him John. John has high anxiety and also was very depressed. John was well educated, actually. He was in his 70s, has a bachelor's degree in psychology, so has been exposed to psych and mental illness, but he himself struggled with anxiety disorder. And so when I approached John and you know, told him about the program, told him how it would be helpful, he was initially indecisive.
According to Centers for Disease Control website, over 1 in every 5 Americans 55 and older experience a mental health concern, but only 1 in 3 of the group with mental concerns seek help.
Some of these patients, when I approach them, will say, I didn't want to get help because I didn't want to seem cuckoo. Or, oh, am I really off the walls? Like, you know, they're so concerned about how they're being perceived.
Even after acknowledging they have a problem, some older adults might not always agree to go through with the therapy. It is the clinician's job to assure the older adults that what they're feeling is normal, but it can be treated with therapy and sometimes medication.
They're going to think about it. That was the one this morning. They'll think about it. They're going to let me come back one more time and consider it. So hopefully I can you know, encourage them into it by next week.
Using the Hamilton Anxiety Rating Scale, clinicians assess the older adult's anxiety level at the beginning and at the end of the 8 sessions, and if they need additional help, they are referred to other outpatient programs or therapists.
Can you not leave? I would love to stay, but unfortunately I can't.
The Cognitive Behavioral Therapy program at VNA is one of the few that specialize in geriatric mental health. As a graduate student in social work, Lucasen realized that if she wanted more resources, she should start doing something about it herself.
There were very few of us in the geriatric track. A lot more folks did the child and welfare track. But that was my focus, and did a lot of study on suicide in the elderly and mental health, a lot of study on depression and how it increases and exasperates.
The National Alliance on Mental Illness reports a $21.4 million cut to the mental health services budget in 2012. The Massachusetts Association of Older Americans works as an advocacy group to try and restore part of the budget that was specific to geriatric mental health.
Yes, there's a comprehensive mental health system and health system, but that there's some issues specific to older adults that make it necessary to really have a system for serving them.
The director of Arlington Council on Aging, Susan Karp, says mental health is not talked about enough in the geriatric healthcare community, and she says as more older adults acknowledge their mental health problems, senior centers should focus on providing mental care resources. In a recent seminar on depression at the Arlington Council on Aging, over 30 older adults attended.
Now, 30 people may not seem like a lot to you when I reference that we serve 9,400. We're not going to have all 9,400 people in this building. But for 30 people to come out to hear a lecture on depression and then take a small exam that gave some indication about their mood, I was so impressed with that.
CDC says it is important to realize that although the rate of older adults with depressive symptoms increases with age, depression is not a normal part of growing old.
It is really incredible that, our oldest patient on this program is 98. And, that she is saying, I want a better quality of life. I don't want to feel this way. I don't want to think this way anymore. I still have a lot of life to live. And how can you help me?
Lucasen says that as social workers, if you don't care, you're in the wrong profession. But it is important to not get too attached. Seeing pain and depression and anxiety every day is difficult, but they keep a distance and stay positive to be able to help more people.
That they too may look at you and say, look at this girl. She ain't got nothing, but she's always happy. She's always joyful. She always has something good to say.
For Emerson College, I'm Shah Sajadi.